the links also, sir.
Sure.
And sir, you can also invite uh, other audience also. We'll approve from our end. We'll admit them.
Sure. So whenever you're ready, just let me know if you want to make an announcement, and I'll start the presentation.
Yeah, just 2 minutes. So we'll make one announcement and we'll. Thank you. Thank you.
No problem.
Dear participants, we'll start within 2 to 3 minutes. So, dear participants, now we'll start our session. And today we have a special session by Professor Mohammad Aazam. Welcome, sir, for this session. We are eagerly waiting for your talk. Even our faculty members and PhD students are waiting for this special talk. and thank you so much for accepting our invitation. Specifically, Department of Computer Science and Engineering, Triple IT CCT, welcome you for this special talk. And Professor Mohammad Aazam, working as a professor in the School of Information System, Carnegie Mellon University. He holds a PhD degree from Kyunghee University, Korea, and he completed other additional academic careers from Howard University, King's College London, University of Nottingham. Professor Azam is a fellow of the Higher Education Academy, UK, and a senior member of IEEE. Before joining CMU, Professor Azam worked as an associate professor in the Department of Computer Science at University of Nottingham, where he received multiple awards for teaching and outreach activities. With over 100 plus publications, Professor Azam featured on Stanford list of top 2% scientists globally and in top 0.1% in the distributed computing. His research area of interest is in the field of smart systems, intelligent IoT, edge computing, blockchain network, Industry 4.0, healthcare applications, and smart cities. He has contributed various standards for intelligent edge computing and specifically for fog computing. So welcome you, sir, and stage is yours. Thank you, sir.
Thank you so much, Dr. Abhishek. Thank you very much, everybody in the organization and for this session and everything, and for having me here. And I also welcome all participants here in the audience. Thanks very much. So thanks for the generous introduction, Dr. Abhishek. We are going to talk about edge intelligence in healthcare. We're talking about edge intelligence in smart healthcare. We'll talk about machine learning today. We'll also talk about blockchain. So my primary area of work is Internet of Things and cloud computing associated with blockchain. And I've worked a little bit on machine learning. So today we'll talk about the need for edge computing, the need for making edge intelligent, having machine learning or AI with edge, and also why is it important for the case of healthcare / smart health. We'll also look at why blockchain is important when it comes to smart healthcare. But we are providing smart healthcare with machine learning / intelligence or not. And also we look at some tools and some libraries related to machine learning that we can use for research or for various machine learning based smart healthcare applications. So this is the agenda for today's discussion, today's talk for the next 1.5 hours or so, or maybe a little less. Feel free to reach out to me. My email, my contact information is there for any kind of collaboration or any kind of questions that you have after the session. Or I know that we have a dedicated session for Q&A, but even beyond that, feel free to reach out to me for any kind of discussion, any kind of collaboration or stuff like that. So now, since we're talking about a few critical things, there are keywords in the title, keywords in the discussion. So in order to clear our heads and in order to create a good context for the things that we're going to talk about today, I think it's important to first understand the definitions or the points of view. For example, one can have one point of view on intelligence. Someone else can have a different point of view on intelligence. And same goes for smartness or anything else. So today we're talking about intelligence. We're also talking about smartness. And then, of course, blockchain and machine learning. So we understand what is blockchain. We understand what is machine learning, but there's kind of an overlap. We interchangeably use the terms intelligence and smartness. Is there a difference, or are these two terms just interchangeable? That's a question right now. So let's try to clear our heads. Let's try to create a black box kind of a thing in our heads first before we get going and fill out details within that black box. And then gradually through the session, we'll understand different things once we populate that black box, the empty box that we'll have right from the get-go. So the first thing is intelligence versus smartness. What's the difference? Now, intelligence is all about learning things, understanding things, and also applying knowledge. This is intelligence. The intelligence that we have, human beings have, is natural intelligence, NI. Now, when it comes to mimicking, copying that natural intelligence to a machine, we call it artificial intelligence. So we have the cognition here, we have the memory here, we have the ability to understand things and then apply knowledge. So we have data, we process that and it becomes information. We process that and it becomes knowledge. And then the next thing is wisdom, which means the use of the knowledge. So that's intelligent. Intelligence or being intelligent. The next thing is, what's smartness then? So now smartness is automation. When you have the intelligence thing, when you have the ability of cognition, realizing things, understanding things, and the ability to act or think quickly. In simple words, when there is automation thing, anything is automatic. Automatic door or smartness within your office, smart home, smart vehicle, smart city, smart healthcare. This means that there is an ability to think quickly and then, of course, situational awareness. So now we have two critical things here. A quick thinking thing. Second thing is context awareness, which is also situational awareness. So these critical things create the ability to automate things. It's not like automatically opening a door. That's also smartness. It is smartness, but there is no intelligence there. So the door is opening for everybody, for example. It's based on presence sensor. So every time the door or door's presence sensor detects someone coming in within a certain range, the door opens. So that door is smart door, which is good, but the door is not intelligent, not opening for a specific person and not making decisions based on certain things. For example, I should open for this person, but not for the other person. So there's no image recognition thing. There's no facial recognition thing. There's no biometrics thing. Hence, there is no intelligence there, but there is smartness because there's automation, situational awareness. Limited or not, that's a different thing. So now we know to an extent that intelligence is all about the ability to learn, understand, and apply knowledge. There would be lots of things going on within intelligence. When it comes to smartness, it's the ability to think quickly and based on some particular context, situational awareness. And that creates automation. So when it's automatic, it's smart. But then can we overlap these two things? We're talking about smart healthcare today, right? And we're also talking about edge intelligence. This means that there is artificial intelligence within edge computing. So I'm talking about intelligence at the edge. I'm talking about smart healthcare. Can we overlap these two things to an extent or not? The answer is yes. Now, to clear up the mind, to clear up the context here for this talk, for this discussion, for this topic, the superset is cognition, the ability to understand things here, the brain thing. And brain has associated memory. So you have stored data, you process that data, and based on that, you have the ability to apply knowledge, right? Now, that ability to apply knowledge is your intelligence. The other thing is situational awareness / context awareness. And the ability to think quickly / automation, automatic things. That's your smartness. And there is an overlap. Today, we're talking about that overlap. That overlap is known as practical intelligence. So this is how I've defined intelligence, smartness, and practical intelligence. And all these things are under the umbrella of cognition, cognitive ability, the cognition that human beings have, and the same cognition that we mimic in machines, and we call it machine learning or / the overarching term artificial intelligence. So you have in AI, within AI, you have machine learning, you have robotics, you have computer vision, you have those kind of things. All of these things are used in healthcare. So now that we know the context of intelligence versus smartness and also the overlap of these two, and how can we name that, which is practical intelligence here, let's go ahead and talk about other things now. Edge computing. So now, since the topic is edge intelligence, the first thing is to clear up the ground for edge computing. We have the regular computing, the classic computing, our laptops, our desktops, our server computers, the kind of things that we've been using all along so far. But then from the past few years, I would say a decade or so now, we've been talking about cloud computing as well. Different from traditional computing. Practically unlimited resources when it comes to computing, when it comes to storage or something else, or providing services. So there is ubiquity, omnipresence of the service through cloud computing, because otherwise it's hard to have services forever for everybody, and hence cloud computing. But then the question is, it's hard to have traditional computing and then the distant over the public internet cloud computing. We must have something in the middle, right? Because various services require a certain kind of middleware entity. So that's our edge computing. Let's decentralize the processing. You have the central server for cloud computing, but then one central server is not enough. You have dispersed users, geographically dispersed, or service-wise dispersed. One user is using a particular kind of service in one context. The other person is using the same service, but in a different context. And then you have a different person using a different service. So now there's decentralization. The decentralization is in terms of the context, the users, the geolocation, these kind of things. Hence, better to have decentralized processing. Data processed closer to the source. So perform as many tasks locally as you can, because this provides fast response and also tailor services. Another benefit is to reduce latency. So now you have much faster processing locally. And of course, you have the ability to integrate to the cloud, and hence for any services that are to be ubiquitously accessible or any extensive processing, you have the cloud computing thing, the traditional cloud computing. So today it's traditional. In the past, it wasn't. So in the past was the client server model that was the traditional computing. And we call it classical computing. The benefits, data locality. I'm talking about healthcare now. My healthcare data is sensitive. Sensitive in terms of privacy, sensitive in terms of security, sensitive in terms of emergency, sensitive in terms of context. So emergency is one context. Do I need an urgent care, an urgent health fix? Because it's a let's say it's a heart attack kind of thing, a quick fix. So depending on the context, perform as many things locally as you can, and hence data locality within healthcare. If you're talking about smart healthcare, it's really important to have data locality for privacy, for security, and also for context, which is urgency, let's say. The performance can be improved because now you have fast processing. You have reduced the latency. So many things are done locally now through edge computing, through middleware technologies. So now this edge computing is a middleware technology. This can be edge computing or edge device. This can be a fog device, fog computing. This can be a mobile cloud. This can be a cloudlet. So now depending on your use case, depending on your scenario, you'll have different kind of middleware entity. Generally, we can call it edge computing, which is fine. And in today's session, we'll talk about certain things that could be performed by regular edge computing or a fog computing, or also there is another kind which is known as FemtoCloud. So we can use FemtoCloud for various personalized purposes, customized purposes. Of course, we'll have enhanced security. Cloud is publicly available. You have to reach out to the cloud via public internet. Now cloud is resource rich, which is really good. I need cloud for many healthcare services, especially when it comes to machine learning or artificial intelligence. I need a cloud. I need more resources. Edge cannot be resourceful. But then I have security concerns. Is there a possibility to prune data, quantify data, classify data, and have certain things done locally through edge computing? Hence, I'll have more security and more privacy, and do the rest of the things that are less security sensitive, less privacy sensitive through a cloud. Maybe for the sake of security and privacy, we can use something else. What is that something else? Maybe cryptography. Yes, we've been using cryptography before as well. Some privacy standards, GDPR, HIPAA, these kind of things. We'll talk about these things today. Yes, we can use that, but then the question is, cloud is resource rich. Edge computing is kind of middleware. I'm not sure. Maybe something else. What is that something else? Blockchain? Yeah, blockchain is viable technology. Blockchain was introduced in 2008 with the first use case of financial transactions, which was Bitcoin. And later on, people realized that blockchain provides certain things that we can use in various other use cases. So blockchain has a block, okay? Blockchain has a block. Block has data and other information. For example, block ID, something associated with the data. For example, when was this data created? Who is the owner of this data? Who has the access to this data? These kind of things. So depending on your use case, you'll have different parts of different segments within your block. So this is a block. Block has data and many other things. One of the things that we use in a blockchain's block is a hash of the block. Hash is unique. And based on the data, the hash is generated. So every time the data is modified, the hash gets modified. This is how we ensure integrity within blockchain. And every block within a blockchain is connected to every other block, directly or indirectly. This is how we can trace everything. So this was the first thing, this was the second thing, this was the third thing. This is how I have the trace of everything, right from the get-go. First thing, second thing, third thing. You have the sequence, you have the trace, and also if someone modifies the data, the hash would also change. So data integrity is also there. And then you have the process of mining a blockchain's block by a network of miners, just like we have blockchain mining in Bitcoin, Ethereum, Ether, etc., and cryptocurrency. So based on these kind of things, we have the auditability, we have the traceability through blockchain, we have the integrity through blockchain, we have the security through cryptography, and you have the auditability. So now you have so many things that are relatable to healthcare. Can we have more privacy-aware healthcare, more security-aware healthcare, more context-aware healthcare through blockchain? Because now we're talking about smart healthcare, right? So yeah, why not? Let's use blockchain for healthcare, for smart healthcare. And also we can include machine learning. So now you have enhanced security, and one of the ways is to use blockchain. Cost is optimized now. You're consuming less bandwidth resources, less resources of the internet, less resources of the time. You're not reaching out to the cloud every time for every single thing. So many things are done locally through edge computing, and fewer things that require more processing, extensive processing, you're using the cloud. And then on top of those things, you have the, as I said, blockchain thing to create more privacy-aware data handling, segmentation of the data, more security-aware data handling. And I'll also explain how you can create more context-aware smart healthcare data using blockchain. A little bit of idea on the middleware entities. You have the end user devices. All the end user devices are your edge devices. Those devices can play a part as edge computing. Maybe two or more of those devices can be consolidated, and it creates edge computing. Remember that edge computing is beyond your end user devices, and it's under cloud. So your edge devices, for example, your smartphone is an edge device. Smartwatch is an edge device. Smart glasses, any body area network, any personal area network, vital signs monitoring in healthcare, blood pressure monitoring, blood glucose monitoring. You have those devices today that you can stick to your body and you can get the data throughout the day. Anything, and similarly, I mean, in the case of vehicles, your vehicles are also end user devices. You're driving a vehicle, it's an end user device. That's also an edge device. Any of the sensors, presence sensor, anything else, these are edge devices. Beyond them is your edge computing thing, which could be through a Raspberry Pi, which could be through your laptop, even your smartphone. Today, smartphones are sophisticated. They have extensive processing capabilities, storage capabilities. We have 1 terabyte storage. We have more than 3 gigs of processing capability. We have cloud on our smartphones as well. So many things could be done using a smartphone. It's a matter of creating automation. Remember the automation thing that I mentioned when we talked about smartness? Quick thinking based on context. So now I have a context. Should I use this locally? Should I send it to a cloud? It's a matter of designing an app based on your context. And that app is based on machine learning, because now you're making your devices, your softwares, artificially intelligent. So you can have an edge computing thing here. You can also call it mist computing. More details are in this paper. And also a more sophisticated, but a smaller level cloud. It's a localized, small scale cloud known as fog computing. And of course, you have the traditional cloud computing. And within the context of smart healthcare, you can do so many things with edge intelligence / providing smart healthcare. So now we have edge intelligence thing, plus we have the smart healthcare thing. I need to apply machine learning now. I need to apply blockchain for different purposes. Can I do that? Some part of it, yes, I can do it locally. The other part, I'll use cloud. But then what kind of services can I create? A hospital environment, and a patient has body area sensors, machines there, ECG, blood pressure, vital signs, so many things going on. Or smart home, or you have those kind of devices within your home. You're connected to Wi-Fi, you're connected to something else. In the future, we'll have light fidelity, just like we have wireless fidelity. We have Wi-Fi 6 today. And by next year, I think we'll have Wi-Fi 7 as well. So this depends on the deployment. In some countries, this will be deployed in the next year. In some other countries, maybe later. But with the passage of time, we'll have more and more sophisticated and reliable, more bandwidth-based networks. And we'll be utilizing networks more efficiently through the technology such as Li-Fi. So we'll be using the natural light or any artificial light, any visible light can be used for data transmission. And it's really good for those environments where There is stability. Right now, I'll just restrict myself on this discussion on Li-Fi, and you can talk to me if you want to know more about this thing. When you're on the go, you have other options, wireless options. You have the wireless broadband thing. In many countries, we have wireless broadband. So the public transport has the same broadband thing on their, let's say, trains, trams, buses, etc. So you have the same reliable broadband network on the go, but it's wireless. So it's really nice. The same stability. If that's not there, if it's not accessible to you, you have something else. For example, your bus has Wi-Fi, or you have 4G, you have 5G, you'll have 16 in a few years. LTE, these kind of things, right? And of course, you have your personal area network, which could be body area network as well for healthcare scenarios. Many of the things are done locally here on your devices, small devices, large devices, 3 gigahertz, 1 gigahertz, maybe more. There is another thing. You can combine 2 devices or more, right? That concept is known as femtocloud. We'll talk about that a little bit later on. So now you can perform more offloaded things locally using edge computing. You want to call it edge computing, mist computing, or fog computing. Depends on your use case, depends on the context. Fewer and more customized resources is edge computing. A small scale localized cloud is fog computing. So in this paper, we named, or we used the paradigm of fog computing, and that's why it's fog here. But you can have edge computing with similar kind of things for data storage and for extensive processing, but not very extensive processing. You have micro data center. Unlike a regular data center, in the case of a cloud, you have a micro data center. You can perform data filtration here. This data is useful for this context. The other data is useful for some other context. So I'm going to use that for some other purposes. Now, without going through a public internet, you can perform security and privacy measures. So those GDPR thing, HIPAA thing, plus blockchain thing could be done here. This is how you can save the power consumption of your end user devices, your edge devices, your smartphone, your smart glasses, your smart watch, etc. Those body sensors, healthcare sensors. Let's save the battery. Let's save the power consumption so that we have a good user experience. It's not just about user interface, it's about user experience. My user is really happy with my smart healthcare apps, even though I'm using machine learning. Why? Because I'm using edge computing, and I'm making my edge more intelligent by having these features there. So data distribution, these kind of things are there. And for the rest of the things, you can offload data wisely, more strategically, based on context, based on different services that you can provide within your, let's say, your country or in your context for a particular hospital, for a particular healthcare provider. For those kind of things, you have the distant, more resourceful cloud. A nurse can use that for different purposes. A doctor, a blood bank. Hey, we have shortage of X blood group in Y hospital. Let's quickly, automatically respond to that instead of someone manually checking the things, blood bank. We don't have A plus, or we don't have something else, AB minus. It's critical. Based on the consumption, based on the usage of these kind of things. So now you get more automation here. This could be through blockchains, smart contracts as well. So smart contract is a part of blockchain, and it performs things automatically, and hence provides you the real smart healthcare that you're looking for. Similarly, managing your IoT devices for healthcare or anything else, for any quick response, first responders emergency response in a more automatic way. You have, cloud computing so that everybody can connect to that and automatically respond to emergency situations instead of any kind of manual processing. The government can analyze data. We have more emergencies related to X thing, such as accidents on Y road or in one particular context, in one particular city, let's say, or a state, more diabetes for X reasons, for Y reasons, these kind of things. And of course, your research can be based on these kind of things. So biotech can develop sensors based on certain context aware or more customized use cases. Insurance providers, caregivers, all these kind of stakeholders can make use of this kind of an architecture, which is edge intelligence based smart healthcare architecture. When we talk about offloading data from one node to another node, this could be in different forms and shapes. This could be one end user or edge device to another edge device, such as smartwatch to smartphone, your blood glucose monitor to your smartphone, or this could be one edge node to a cloud for extensive processing. Could be cloud to an edge. Hey, look, I'm a cloud, I'm distant. I take more time when it comes to receiving the data or sending the data. For more emergency related information or services, it's better for you, edge, to perform tasks. So this is how a cloud can be offloading to an edge as well. This is possible. So it's not necessarily an edge offloading to the cloud every time. It could be the other way around. Also, this could be a cloud to another cloud, and so on. You can go over more details in the paper that I mentioned here, the cited paper. So now resource trade-offs and offloading. We have talked about offloading. Edge devices resources are generally good for fast response, and they're good for enhanced privacy, but then not beyond that. To a certain extent, we can do things locally, but then after that, we'll need cloud computing. So for computationally intensive tasks, we'll send the data to the cloud. But then, as I said, it depends on the context. It depends on the time criticality. How urgently do you need something? If it's not urgent, do you need really reliable data? Do you want me to really analyze your data and come up with a really good solution for you? Machine learning based, it requires more processing. So now in this context, it's better to send the data to the cloud. Look, cloud, I can perform certain tasks based on machine learning locally. For anything that requires error-free, no mistake, no error in my data. It's healthcare data, it's sensitive. And hence, for those kind of contexts, I'll send my data to the cloud. Store the data, look at the inferences, look at the historical record, face everything, and perform certain tasks for my smart healthcare. So it's a holistic healthcare now, and it's more accessible through cloud computing. The trade-off is also related to how many resources should I have at the edge. My edge device should be how much resourceful? Can I have good enough maintenance for that? Can I have good enough number of users taken care by my edge devices, my edge computing? This depends on that. So depending on the resources that you have allocated for your edge computing, you'll have the capability of processing the data. So to a certain extent, for example, up to 10,000 or a bit more billions of instructions, the edge computing was good enough in terms of delay, processing delay was good enough. This blue thing, the blue line represents the delay of edge device. The red one represents the delay of the cloud device. So this is the point. 1,000 billions of instructions. At this point, based on the edge device that we used for this study, and you can go over the details here, the edge device performed better in terms of delay, much less delay compared to the cloud. But after this time, after this point, depending on the capabilities of the edge device, the cloud device became better because cloud has more resources and can perform tasks on certain resource-intensive tasks. So this tells us that edge computing is not always better, even in terms of delay. We'll be using edge for minimizing the delay, for minimizing the latency, but up to a certain point, after which cloud becomes better. So what is that certain point depends on your use case and also depends on how resourceful your edge device is. So it's a strategic decision that you have to make when it comes to my edge devices should be small scales and many distributed across geo network, depending on my patients. How are you taking care of your patients right now? Or healthcare users, not necessarily patients. Everybody can be using different healthcare sensors. Our smartphone, smartwatch, etc. These kind of things can be used for various opportunistic healthcare use cases. You have personalized care. You have data-driven decisions now. You have integrated systems. Multiple entities could be integrated to the system. And also when you have the cloud integration, you have many more stakeholders, as we saw in the previous example. More proactive health management, because it's on the ground now. It's localized now. Defining edge intelligence, you're including artificial intelligence into your edge computing, regular edge computing. You have real-time insights, you have improved efficiency. Generally speaking, if you have statistics on this thing, this would be overall more efficient compared to the traditional system of healthcare, compared to the regular cloud-based healthcare. It's more efficient eventually, even though it appears that edge devices are small-scale devices and it's hard to have machine learning-based tangible services, but it's not true. We'll also talk about some tools and also libraries of machine learning and generally artificial intelligence that we can use for edge devices to make them powerful and intelligent. So it's quite doable now. As I mentioned, edge devices or edge computing can have different forms depending on how big your edge computing should be or middleware should be. If it's in a mobile scenario, you can have a cloudlet for that or mobile edge device. For a localized kind of small scale cloud computing, you should have fog computing for that. For even smaller scaled middleware, you should have edge computing. There's another thing, femtocloud. Combining the edge devices, resources, storage or processing or anything else is femtocloud. Look at your edge devices, such as your smartphone. What's the processing capability of your smartphone? 2 gigahertz, 3 gigahertz, maybe more, but at least they should be more than 1 gigahertz, right? In your available time, just look at your smartphone's storage. And I mean, you know this already, but just assume that even in this session today, I don't know how many people are in this session, but if you look at everybody's resources of their edge devices, smartphones processing, smartphone storage. And since right now we are engaged in this session, we are not really using our smartphones or our smart devices as much as we would use in any otherwise scenario. So there is an underutilization of the resources, at least for 1 hour, for 1.5 hours. Can we combine those resources and perform tasks locally? 10 devices of 1 gigahertz each means 10 gigahertz. That's more than 3 laptops, I would say. 20 devices, and even if it's 2 gigahertz, that's 40 gigahertz, right? What about other scenarios? For example, commute. Let's say someone is, or even in the case of air travel, what's the longest flight? Generally speaking, it's 17 hours or something. How many passengers flying in that flight on average? More than 200? Everybody has at least maybe 2 gigahertz of processing capability, and not everybody is using their phones all the time, right? Why not combine that? Why not make use of Femto Cloud and perform several machine learning based tasks and provide better smart healthcare at much cheaper cost? These are the different things that we can do with our edge computing to create various scenarios for smart healthcare. We've also worked on floating fog computing on vast waters for aerial communication. And we have satellite-based aerial communication as well. So we have the internet there, and we'll have better internet in the future through Starlink or something else. So you have these options here, and feel free to talk to me if you want to know more about these things or explore this concept of how we can consolidate resources and create an ad hoc kind of edge computing infrastructure. You have these examples, and I've shared the slide deck already. So you can go over the examples here that if I have edge computing, if I have Femto Cloud, what are the number of things that I can do for smart healthcare? So on these slides, I've mentioned different kind of use cases, different kind of case studies that you can start with if you want to do any kind of research or explore a particular domain within healthcare. The examples are given. The discussion that I'm doing right now is more based on a holistic approach, but then more examples or fine-grained examples are on the slides. So feel free to go over the slides or talk to me. We'll minimize latency, we'll have better privacy approach, and we have better connectivity for underserved areas. So now another problem is that we have underprivileged or underserved areas or people where providing healthcare is difficult. And also via public internet, privacy and security both are huge concerns. And for healthcare, it's even bigger of a concern. What about data breaches? What about security concerns in general? So many, yeah. You can go over the source file and look at the rest of the details on security breaches or hacking and these kind of things. We have all the reasons now to use edge computing for edge intelligence for smart healthcare. The number of people affected by security breaches just in 2024 is more than this number. It's more than 160. I have to do a little bit of math here, I think. So this this is units, 10,000. I think this is 160 million, right? 160,000 is million, right? So more than 160 million people were affected by security breaches just in 2024. How huge is that? And you can look at the historical record, 2023, 2022, and so on. So this makes a really good case for edge intelligence. If you want to explore the privacy standards, go over these standards: HIPAA, GDPR, CCPA, PIPEDA, etc. They could be something specific in your country, and please explore that. And based on that, you can create a mechanism for more privacy there / security there. So for security, we'll use encryption, decryption. And one of the most sophisticated ones is Kajak. So maybe we can use that. But then for privacy, we have different standards now. And in different contexts, we have different standards, right? So maybe creating a smart healthcare that is more acceptable all around the world could be something that you can explore. So privacy standards in smart healthcare is a really good topic for more globalized kind of healthcare. And for anybody who's interested in exploring what kind of research I can do in this domain, you have these examples. So the slides are shared, so you can go over them and you can explore these things more. We just talked about underserved areas or underserved people. Since we're talking about healthcare, it's critical to make sure that healthcare is provided to as many people as possible, and the same quality of healthcare in whatsoever way. Now, our preference is to provide the same healthcare to everybody, but it takes time, right? It's not that easy to do that for various reasons. This could be related to technology. This could be related to reach. A doctor or a physician cannot get to those places where we need various forms of healthcare. Maybe in remote area, we don't have connectivity or these kind of things. So we worked on a particular kind of healthcare, and we called it opportunistic healthcare. Just like you have e-health, electronic health, and you have m-health, mobile health, you have o-health, opportunistic healthcare. Whenever you have an opportunity to provide any kind of healthcare service, provide that. Instead of nothing, it's better. And it can be in different forms and shapes. Let's look at this example. It's just a recent thing. It's not an outdated thing. It's today's thing. This news was published, I think, 3 or 4 days back. And this is in Argentina. And in many other countries, this is a problem. In actually most of the countries in the world right now. You have remote areas, you have less connectivity. You have underserved people, underprivileged areas. If a doctor can go there, doctor possesses edge devices such as smartphone, can gather data from various people. Instead of manually checking everybody, the doctor can examine how many people in one time, maybe in 1 hour, maybe in 1 day, how many people? It's just one doctor. What about we get the data from there in a more automatic way, smart healthcare? And then when the doctor comes back to the better networked area, for example, metropolitan, the doctor can offload the data to a localized server, edge computing, with intelligence, with machine learning, perform inferences based on that, make decisions, and then revisit the patients. That's much more productive, much more efficient. Also, minimizes the human error. The doctor is gonna get burned out. Doctor is gonna get fatigued. Let's minimize the human error thing and make the best use of machines that we have. So how many doctors per 10,000 people right now? For example, in India, we have I think this is the number, more than 10 doctors per 10,000. In the past, this was like this in 20, so this study that I did was, I think in 2017 or something, 2018 maybe. And we had how many doctors at that time? So once again, I have to do some math now. I'm testing myself. Unit 10,000, 10,000, 100,000. So that's, I think, 9.9 million, right? If that's 9.9 million, this should be 13 million, right? So today in 2024, we have 13 million doctors in India. The next question is, how many of them commute via public transport? So the ones who are driving, they're busy driving, right? The ones who are not driving, actually not necessarily just the public transport, also the ones that are using anything such as e-hailing or someone else driving them to their workplace, they have X amount of time to look at patient data if we have smart healthcare based services, right? Why not make use of the commute time of the doctors? Just like the example that I just discussed of Argentina or any other country. Every country, I would say, has this problem. Small extent, large extent is a different thing. So if you want to go over this study, this is not a new study right now, but this is something that we can extend today as well, because it makes a lot of sense. As I said, the example that I just showed was just a recent thing, 3-4 days back. So the idea here of opportunistic healthcare is to look at the opportunity for providing healthcare. Any opportunity. It's public transport. I'm using public transport, so I can use my phone and maybe answer some patient's questions. I have fever from the last 2 days. I also have cough. So the doctor can ask, do you have X symptom, Y symptom? Maybe you should go to a doctor. So now the patient is going to a doctor only when it's needed. Or the doctor can respond, hey, just take Panadol, that's it. Nothing serious. You don't have to go to a doctor. So do not consume resources unnecessarily. And this is a problem in many countries, in many developed countries as well, where when you request for a specialized doctor, it takes several months to get the appointment. And when you talk to the doctor, you realize that it wasn't needed in some cases. So in many cases, it was needed much earlier. So if someone has to wait for 6 months, and it's not a random number that I'm throwing right now. It does take 6 months, 8 months or more, even in developed countries, to get an appointment for a specialized doctor specialist. And any two random people requesting for that, it is possible that one is doing that unnecessarily, just to be on the safe side, while the other person needed that much earlier. If we can minimize the unnecessary visits to a hospital or service provider, healthcare service provider, we can maximize those who need that more urgently. This is opportunistic healthcare. To provide opportunistic healthcare, we have to understand that even though we talked about edge computing, fog computing for the sake of minimizing delay, for many services, delay is not a problem. Let's assume that a patient has smartphone monitoring their physical activity and then, blood glucose monitor, offloading data to the smartphone and monitoring periodically the blood glucose. And then you have the vital signs, ECG, body temperature, etc. Then you have the many other things, many of the associated data for healthcare, such as food consumption, the type of food, the time of the food, the resting period, the outside temperature, the room temperature, these kind of things affecting the body, especially for elderly or the ones that already require attention related to healthcare. For these kind of things, there is a possibility that we can wait for a certain time. What if offload my entire data by the end of the day, at night, when I'm sleeping, I'm not using my phone, offload the data to the cloud, offload the data to edge devices, edge computing, fog computing, process it there. Look at my entire day's everything. Use machine learning, predict. And recently in India, actually, someone was using smartwatch, I think, and they got an alert related to ECG, and they went to the hospital and they realized that they were about to get a heart attack kind of thing. So this was avoided through these edge devices, and this could be made more sophisticated when you have more machine learning based edge intelligence. So the concept here is that make use of edge computing for also delay tolerant applications, not necessarily for low latency applications, but also for delay tolerant applications. So the same doctor's smartphone or any smart devices getting data from underprivileged and less connected people, and then processing it later on when the doctor gets into a more sophisticated network with more co-located intelligent devices. And then whoever goes back to the same location, same remote area, can update the patients. Those people can be using smartphones, maybe not sophisticated smartphones as the ones using in a metropolitan area network or in a city, but still they can get the refined data. This is opportunistic healthcare through delay tolerant computing. The concept is similar to delay tolerant network, DTN. So the concept here is delay tolerance, DT. Do you want computation reliability really high? Go for the cloud. Not so high, a little bit of processing, go for femtocloud, go for edge devices. A bit more, go for edge computing. You want to save cost, go for femtocloud, edge devices. A bit more, edge computing. High cost, can you afford that? Because now your concern is healthcare. I need really sophisticated processing of my data. So my initial processing was at a low cost. So edge computing, that's good. For more inferences, for more high-level machine learning things, I can pay more. It's my healthcare. So send that data to the cloud. Privacy, low here, medium here, high here. Security, high here, medium here, low here. Because now for security, you're using security algorithms. So this is the trade-off. Classical computing to delay tolerant computing. If you want to look at how or what kind of things we can do for research, these are the examples. And same goes for drivers' behavior monitoring, drivers' healthcare. Modern vehicles today have a number of sensors. They're really good. And today's modern vehicles give us enough notifications. So they're using some sort of edge computing there within the vehicle. But then the thing is that it's more for the sake of assistance. Hey driver, you're not wearing seat belt. Hey driver, you're changing lanes too frequently. This is driver assistance. This is not really related to healthcare. Is the driver looking at the road straight, eye tracking, right, left, talking too much with the passengers or the one sitting next to the driver? Voice recognition thing? Hands on the steering? Both of the hands? Yes or no? Drivers fatigue through image processing, facial expression recognition. This is machine learning, computer vision, artificial intelligence. Drivers' healthcare is even more important. And you have this example as well. And also, through these concepts, we can have a holistic smart city-based smart healthcare. Your traffic light can turn green for an approaching ambulance to avoid delay. Turn red for the rest of the intersection, but green for the approaching ambulance. So you're tracking the ambulance based on GPS, and then you have a small chip associated edge computing, roadside edge, or for more sophisticated purposes, you have the roadside fog computing or fog service. Let's take a quick break for a few seconds and we'll resume the session.
Dear participants, we'll take a short break for 5 to 10 minutes. After that, we will again start the session.
So, Dr. Abhishek, let me know when I can resume the session. Okay, I'm ready
Yeah,
for
yeah.
that.
Okay, okay. Thank you, Professor. You can start. You can
Okay.
start as per your.
Yeah. So since today we're talking about intelligence, the quote is also on intelligence. The ability to observe without evaluating is the highest form of intelligence. But then machines have to evaluate. So we don't need this kind of intelligence in the machines. The intelligence for the machines is different, of course. So let's resume. Generally speaking, the patient outcomes would be improved. As I said, the underprivileged thing is one thing. The unnecessary visits to the hospital, and I've provided the references to the research that I've done before. So go over those publications or research works of the past to look at more details or of how underutilized, overutilized resources could be made more balanced and hence have better patient outcomes. And with these kind of things, machine learning and with the inclusion of edge intelligence, we can have more personalized treatment. As I said, some of the things would be done locally, the others would be done via a cloud. So I'll quickly go over the rest of the things now because I've talked about most of the things. And in the interest of time, I think I have less than 10 minutes and we can just go over the things. Plus, we can talk about the tools and also libraries for machine learning. Resource optimization, of course, streamlined processing, cost reduction. So many things could be done using a femtocloud. So many things could be done using edge computing. So you're not really consuming resources of cloud. It's more bandwidth intensive. Privacy and security. We talked about this thing almost at the start of the session. And when we talked about this thing, we also talked about blockchain. So now blockchain, just to recall, provides us traceability, provides us integrity, provides us auditability, provides us security. When you need these kind of things, you can use blockchain for various healthcare services. But then what could be the examples here? If you talk about privacy and security as a primary thing, and one of the primary use cases of why I should go for blockchain for my smart healthcare, let's look at one example. So one of my students, Laiba Samir, worked on this thing, a framework kind of thing, an engine kind of thing, using blockchain for more privacy and security-based smart healthcare. You have the user there, and then you have the privacy standards. As I mentioned, you have different standards. And in different contexts, in different geolocations, you'll have different standards. So you can include those standards there, and with machine learning, with AI, with more intelligent healthcare, and on top of that, you have the smart healthcare thing, so more automation thing. You can decide what kind of privacy of the data you're providing. My data right now is private to everybody. In another context, for example, emergency, it's not private. So please provide my data to first responders, to nurses, paramedics, because I don't mind it in that context. So now the context is based on machine learning, intelligence, smartness, plus blockchain. Another thing is that my identity, everything related to me, my name, my date of birth, my blood group, my age, diseases that I had in the past, anything else, my hospital record, my health record, historical record, my bank accounts, insurance-based transactions, more automatic transactions through smart contracts in blockchain. It's a good idea to have flexible identity. So right now, my entire identity is not in my control. The government has provided me an identity, and then in different contexts, I have different identities. For example, in a banking context, my identity or my details are different. And I have to manually provide those details to the bank for, let's say, opening a bank account or performing a transaction. Do I have enough funds or not? And all those kind of things create various middlewares or hiccups, less automatic, less smart. Through blockchain, and especially blockchain smart contracts, I can have an automatic contract. I can provide you with my identity for this context for X time, for 1 hour, for 1 day, for as long as I'm hospitalized. As soon as I get discharged from the hospital, you don't have access to my data anymore. So now it's more privacy and security aware through flexible identity management. This work was done by my students, Mona, Angela, and Albina. Mona and Angela are also affiliated with American University of Beirut, and Albina is with CMU. Now let's talk about some of the devices for edge intelligence. It's not limited to your laptop or smartphone, or let's say the typical devices that we use today, such as Raspberry Pi, Intel Edison. Today, you have more sophisticated and tailored devices for edge intelligence, such as NVIDIA Jetson Nano. It's similar to Raspberry Pi, but it's specifically designed for machine learning and AI-related tasks. The size is similar to Raspberry Pi. So it's a hardware, but it's more sophisticated and can perform AI and machine learning-based tasks for edge devices. So now if you're using this kind of a thing for edge computing, you have a much better chance of providing more sophisticated edge intelligence-based smart healthcare. In healthcare, especially when you need a longer range, you should be using protocols such as LoRaWAN for rural healthcare. So you have the long range plus low power wide area network for IoT communication, IoT devices, healthcare devices. If you want to explore research-related opportunities within this context, look at these topics: convolutional neural networks, and also there's one more thing: recurrent neural networks, RNN. So CNN is one thing, RNN is another thing. For periodic vital signs monitoring, you should use RNN. For, let's say, image processing, computer vision kind of thing, CNN is better suited. And of course, combine that with healthcare data coming in from various IoT sources and apply blockchain on top of that for the sake of security, for the sake of privacy, and also for the sake of traceability. I have the trace of everything that has happened to this person. The sensor generated this data first, and then the second thing happened from the same sensor or from another sensor. So you have the entire trace through blockchain. Through machine learning, you can perform pruning and quantization of your data, and based on that, you can create classification. So now classified data provides more context-aware smart healthcare. Examples of what can I do using machine learning and edge computing? You can use these examples, but these are just a couple of examples of what you can do. You can do many other things other than these. One of the things that we've done is fall detection. So using your sensory devices, edge devices, you can detect fall. and respond. Someone is living by themselves, living alone, nobody there. Maybe they're elderly and they get unconscious. Can we use technology to quickly respond? But the response or the understanding of the situation should be reliable. It shouldn't be a false signal, no false alarm. Go over this paper for more details or talk to me for the research directions on this thing. Some real world applications that you can work on. Generally speaking, using blockchain, we can trace everything, all data from one or more sensors. We can protect the data's integrity. We can create context-aware services, because now we have more privacy-aware, more security-aware, and of course, traceable data through blockchain. This framework of how blockchain can be used for smart healthcare was presented by my students Aisha, Latifa, Moza at CMU just recently. Now the thing is that we have talked about general healthcare. We have talked about healthcare of underprivileged, opportunistic healthcare, delay tolerant healthcare. We've also talked about driver's healthcare. There's one critical thing that we haven't talked about yet. That's the healthcare of the healthcare providers, the doctors, paramedics, nurses, everybody that is associated with any medical service provider, a hospital or a pharmacy or any Medicare kind of thing. They're also prone to fatigue, stress, and burnout. You have these stats here. And my students, Munira, Anastasia, and Ahmed worked on this particular thing based on sensors on those healthcare providers, getting data from those healthcare providers, and using machine learning plus robotics. So a robot would roam around and through infrared image sensing would sense the facial expressions to detect any stress or burnout, plus combined with the body area network, body area sensors, and then using machine learning on top of that to understand the working conditions of healthcare providers, which is also really critical here. Some research opportunities or directions related to that. Some case studies that you can explore. So similar to the things that I've mentioned, I've given some examples here for the people who are interested in exploring more in terms of, we have edge intelligence. So we have now different edge devices such as NVIDIA Jetson Nano, Google Coral as well. I think I've mentioned that somewhere. And then you have the lightweight version of TensorFlow. And also somewhere I've mentioned, so this is edge TPU as well, that this is also a device for edge computing with intelligence, so edge intelligence thing. You have PyTorch mobile as well. You can also go over this work related to how we can provide tactile-based remote healthcare, so remote surgery kind of thing. This is also possible, but then it requires reliable connectivity, such as through 5G or really sophisticated broadband network. But it is possible now. And through private 5G, it's even more possible, and you can perform these kind of things in underserved areas as well, remotely. Someone sitting in a city providing surgery to someone sitting in a remote area through private 5G/5G. So it's a matter of connectivity now. If you do have the connectivity, you have the means now. We have tactile internet. We have edge intelligence. We have fog computing. Combine everything and provide that. It's doable. That's also part of intelligent and smart healthcare. Bias mitigation as well is also possible through machine learning. So it's more automatic now, plus it's more inclusive. Some emerging trends. And remember that we have more tailored kind of devices or hardware today, such as, we used to use CPUs for regular processing. For more complicated processing, such as blockchain mining and also graphical processing, we use GPUs. For AI, we have Tensor processing unit TPU that I mentioned just a while ago. And the other thing is NPU, neural processing unit, neural, just like neural network. So making use of those things in your edge devices would make them more suitable for edge intelligence-based smart healthcare. And another thing that you can explore is shadow AI. A part of AI that's working in the background and constantly monitoring your situation or providing you services. It's a silent guardian. That's also something that you can explore. So shadow AI-based edge intelligence and smart healthcare. So in summary, making use of blockchain for traceability, security, for more tailored identity, fragmented, flexible identity-based services is something that we can do for smart healthcare. We have the hardware, we have the libraries, we have the software, we have the means for edge intelligence-based smart healthcare in opportunistic networks, in regular networks, in delay-tolerant networks, in delay-sensitive networks, remote surgery as well using 5G, plus ethical considerations. We have all these kind of things today for better and better, more sophisticated, intelligent, smart healthcare. And that is it from my side. You have my contact information and feel free to ask questions. Thank you very much. So I don't know if the questions are going to be posted somewhere. Do I need to look at the questions, or would you be unmuting yourselves and asking questions?
Yes. Thank you, Professor. Thank you so much for your insightful and valuable talk. Our participants and PhD students have gained significant knowledge and inspiration from your talk, as well as the research contributions. So your presentation has sparked meaningful discussion and provide them a fresh perspective on the subjects. So participants has shared few comments with us. So our team will discuss the points. But from my side also, I have few comments, sir.
Yeah, sure.
For example, yes. So for example, if we design some prototype as well as designed some model with fog computing and edge computing, maybe for smart sensing, smart healthcare, as well as for any type of IoT based smart application with the help of fog and edge computing. The question is, sir, is it possible to go for patent or standardization for IEEE? So this is my comment, sir, or
So if
my
the question, yeah, sure. Thank you for the question. If the question is whether this is possible or not, the answer is yes, it is possible. But when should you go for this is another follow-up question. The thing is that healthcare is a sensitive thing. You have privacy concerns. So that's why we talk about privacy standards. You have security concerns as well. And then on top of everything, you have compliance concerns. So now, for example, in the US, every state has different rules. Now in India, for example, you have different states and you have to follow the rules of the states to be compliant of the state's regulations and also the central government's regulations. If you're collaborating with the Ministry of, let's say, Healthcare, or a stakeholder that has a say or that has something to do with the compliance, it makes more sense to come up with a solution or prototype that is more acceptable. Because if you create a prototype, how would you convince people to use that? You have to be compliant of certain standards set by the government or whatever government the people are going to use under. In your country, in some other country. So the first thing is compliance thing. The first thing is meeting the standards, such as privacy standards, HIPAA, GDPR, etc. If that's done, going for a patent for any prototype makes a lot of sense.
Okay, okay. So thank you so much, sir. Our one PhD student is there. He is particularly working in this domain only. So he has few questions. So if you please guide him, then it will be helpful for him also.
Sure, sure.
Thank you. Thank you.
Sir, thank you, Abhishek sir, and thank you, Azam sir. So it's indeed a great pleasure. It is very informative, and even it gives us, uh, the future direction also. Sir, I have actually one question. I'm working on this Jetson nanobot, sir.
Yeah,
So it's actually a little bit high price,
yeah.
but like I want to work with the tiny machine learning models. So could you suggest me on that? Like, will it be okay? Because the pricing also matters, right? Like, so when you are trying to make it as a product, so when it comes to the product, price, then it will be huge, right? Like I use that device.
That is correct. So the examples that I mentioned, and feel free to look at the slides. I've given examples of libraries, machine learning libraries, or generally AI-related libraries, and also the devices. So Google Core is another option. You have the NVIDIA Jetson Nano. That's one option. I understand it's expensive. So for the sake of prototyping, for the sake of research, maybe the initial approach could be to go for a cheaper option, such as a Raspberry Pi that's not that expensive, or maybe just use your laptop and combine that with your smartphone to just create a prototype kind of thing first. Once you have the prototype ready, you can go for a more sophisticated and a small scale device such as Jetson Nano. So now once you have the Raspberry Pi or you're using your smartphone or something, the next thing is, can I use the same machine learning libraries on my small scale smart healthcare prototype? The answer is yes and no, because it depends on the context now, how complicated your machine learning model is. So what's the alternative now? I'm using Raspberry Pi. I'm going to go for a cheaper option. Absolutely fine. Can I mimic the Jetson Nano only by using Raspberry Pi? The answer is yes, you can. And you can use TensorFlow Lite that's backed by Google. Alternatively, for inferences and classification, you can use PyTorch Mobile that's backed by Facebook. So you have TensorFlow Lite or you have PyTorch Mobile. These are lightweight libraries for machine learning. You can use either of them. And then you have, of course, Keras developed on top of TensorFlow. And you also have scikit-learn. Using these libraries, you can create a sophisticated but lightweight machine learning model using Raspberry Pi or using your smartphone. So now you don't have to use expensive machines. So that's the alternative.
Is that, uh, I have actually one more question. It's regarding
Sure.
communication. You know, uh, like over like the Wi-Fi what we are using, which may not be available in the remote places, like where the disaster scenarios taking place. In that
Yeah.
case, what could be the possible, communication standard which will give us the continuous stream. Actually, I'm working on the disaster management area, so we are working on this radio wave communications and all. But still, they are also expensive. So any cheaper kind of, as you said, like TensorFlow Lite is very good. That's what maybe insightful information I will get from
Yeah. So if there is no connectivity at all, but you have the possibility to create ad hoc network, this depends on the affordability. One option is to have long range Wi-Fi kind of thing relayed using drones. So now you have a fleet of drones, just like you have routers and you have access points. So you can have drones equipped with access points or routers spread over a wide range. If that's also expensive, another option is to create a localized network there in the disastrous area, and then take the data from there through delay tolerant network approach, the thing that I mentioned as delay tolerant computing. So you have the delay tolerant network. This means that there is no end-to-end connectivity. It's not possible. If it's possible, it's expensive. For example, you can use satellite-based internet communication as well, but that's also expensive, right? So maybe that's not a good option for you or for someone else. Is there an alternative? The answer is you can have data gathered through FemtoCloud there as DTC, delay tolerant computing. And once you're back in the area where you have reliable connectivity, you can offload the data to a more sophisticated device or devices and perform extensive processing. So now you can still provide services. It's just that they're delay tolerant. Instead of zero service, it's better to provide something. But that's in the case when there is no possibility of any kind of network. Otherwise, you can have private 5G. And if you look at my research work on 5G, you can see that private 5G is also an option there. So depending on how much expensive you can, or depending on the affordability in general, you can create networks. As I said, satellite communication is one option. What's the name of Elon Musk's satellite-based service provider? The name starts with Starlink, yeah. So you have Starlink, but of course it's expensive, and if it's not there, if the service is not there, you cannot have that. The other option is, of course, using drones and creating an ad hoc kind of network. The other option is the mobile network in a remote area using a remote or mobile dongle or USB device for internet connectivity. If that's also not possible, then the least you can do is to create a delay tolerant computing or delay tolerant network and then provide services.
Yes, thank you, sir. We are working on the fleet of drones only. So,
Okay.
thank you, sir. Thank you so much for your
Yep.
answers.
No problem.
So thank you so much, Professor, Department of Computer Science and Engineering uh, at People IT CCT. Uh, give a special thanks to you for your valuable time. So we really enjoyed your session. Our faculty members also attended this session. So thank you so much. We'll share your slide and videos with our participants, and we'll also provide you the link as soon as possible.
It was my pleasure as well. It was my great pleasure. I thank you all for attending. I thank the entire faculty and organizers of this workshop or the entire session across multiple days, I think. So I thank you all for having me here. And it was a great pleasure talking to you and these kind of things. Anything else needed from my side, feel free to talk to me, okay?
Sorry to disturb you, sir. Yeah, sorry. And there are some questions in the chat box as well.
Oh,
Yeah, thank you, sir.
So where is the chat box? I'm not used to Google Meet actually.
Okay, sir, I will read the question, sir.
Yep, sure.
Sir, can you please give brief of Li-Fi technology?
Oh, okay. So just like you have lights in your room, artificial light or natural light, we can use beams, frequency beams of the light to transport internet or communication signals. Just like, you know, any other light, for example, Wi-Fi uses electromagnetic waves. You have the electromagnetic energy in light as well. Why not use that? It's better in terms of security because right now, when you're using light, the communication takes place when the light exposure is there. Wi-Fi signals are beyond your confined boundary. So outside of your room, your Wi-Fi signals are also accessible. More chances of security breach, man-in-the-middle attack. In the case of Wi-Fi, light fidelity, that's not the chance. Within your room, you have the connectivity, you have the processing capability, more focused beams for particular kind of use cases of transporting signals from one point to another point. And hence Wi-Fi is the future. It's just that it requires different kind of transceivers, receiver and transmitter. So that's why it's not readily available right now, but this would be available at some point. So that's the concept of light fidelity or Wi-Fi.
Thank you, sir. We have another question also.
Yeah, sure.
How advanced in AI improves edge intelligence performance?
Advanced AI improves what?
Improve the edge intelligence performance. Like how AI can help edge.
Yeah, so based on the things that I mentioned in the talk today, if you're using edge devices specifically for intelligence, for example, I mentioned the tailored devices. Google Coil is one device that is tailored for AI-based edge computing. So now the device can perform extensive tasks similar to a more sophisticated computer, but then it's more tailored to AI-based tasks. And based on that, you can have much more sophisticated machine learning-based smart healthcare. Similarly, you have the Jetson Nano. So based on these kind of devices, edge devices, you have intelligent healthcare. Artificial intelligence and machine learning is there. If that's not possible, then you can use those libraries that I mentioned, PyTorch Mobile or TensorFlow Lite or these kind of things on your regular devices such as Raspberry Pi. So now your Raspberry Pi is used as an edge device, but then using PyTorch, TensorFlow, the lightweight version, you can perform similar kind of tasks that you would do for any other machine learning based intelligent smart healthcare.
Thank you, sir.
Problem.
So thank you so much, Professor. Thank you for your contribution.
No
Dear
problem.
participants, we will meet in our next session. Thank you.
Thank you. Goodbye.